With the ISO-free, we're able to capture a live 3D image of a patient, of an individual, and as they're going through movements, the system allows us to set markers or draw lines on the camera itself, so we can have targets that the specific patient can achieve. A deep squat, or reaching for a target with their arm, or doing some hip abduction, moving their hip out to the side, looking for specific targets. Now with that, what we look at is that we look at their balance, we look at their stability, we can draw lines and make sure that their hips aren't, having a Trendelenburg or dipping. Maybe that allows us to identify some other weaknesses that's going on that we can address, not only what's going on with their affected side. So what we look at is, so before we can have any kind of body movement, we have to have stability. So with this force plate and with the ISO-free, it allows us to have stability, and it gives us sensors on whether or not we're moving our trunk to compensate, or if we have a mechanism of moving our feet, moving our balance off center. This allows us to center our balance, our center of gravity, and allows us to work our core so we can do dynamic activity. So what we're looking at on a jump test is a standard jump test, but we're able to look at not only video monitoring of how high we jump, how we compensate, but it also measures the force and power that we jump at. So we're allowed to gather all this data, see if we're post-op knee surgery, post-op ACL, surgery, knee surgery, that we're able to get back into any kind of return to function. We're also able to put a grid, markers on a person through the 3D image without having to go through and actually put markers on the body. The camera does it automatically. So what we're able to look at is we're able to look at range of motion. We're able to look at how a person moves or compensates with an injury. And that way they can actually see it, besides the physical therapist just telling them that you're not moving right, you're not doing something correctly. It allows them to visually see it on a 3D image as they're moving through it.